Dr. Kris Jatana, professor, otolaryngology, head neck surgery at Nationwide Children's and Ohio State University. That's a great question. Our American Academy of Pediatrics recommends honey only after 12 months of age, for the reasons that you've described. That being said, I help lead a global battery task force that has been focused on advocacy and injury prevention around these types of ingestions for over a decade now, and we've talked with colleagues in other countries and many other countries do exactly what you say as far as just giving honey to infants, knowing that domestically sourced honey is very safe and that risk is extremely low compared to the known risk of a battery eroding through the esophagus into the airway or into adjacent structures or including important nerves and blood vessels that can be potentially life-threatening. And so it's something that while our current guidelines for when to use it are over 12 months. One of the reasons we adopted the sucralfate recommendation as well and validated that it also works is it gives us a medicinal option that can be used for an infant in the hospital setting once the diagnosis is confirmed. I think it's important for pediatricians and other healthcare professionals, that interact with pediatric patients to be aware that this battery exists, this technology exists. And when we think about different ways to prevent injury, we think about safer packaging, warning labels. The battery packaging requires scissors to cut the battery out, which historically you could pop it out like a piece of bubble gum from a candy wrapper. And so there's been significant strides by industry to make packaging safer, make warning labels better. Based on Risa's law, these are all mandated as of 2024 for manufacturers of electronics and batteries to comply with these safety regulations. However, with the esophageal protective battery, we're addressing the actual hazard itself. So we think about ways that we can actually reduce the hazard severity of the battery, and that's what this technology is accomplishing. It's making the battery, should it be accidentally ingested and become lodged in the esophagus, significantly less risk of having a severe esophageal injury or death as a result of that accidental ingestion. And so just knowing that this is out there when performing anticipatory guidance on different types of hazards, in the home and outside of the home, I think it's important for pediatricians to consider just letting parents know that there is this safer technology available to power devices in the home. And we know there's a lot of different devices in our homes that utilize these types of batteries. And so just knowing that there is a advanced technology that is significantly safer, should it be accidentally ingested, I think is an important point to pass on. But to also still treat that as an emergency if you suspect or witness a child swallow one of these coin cell batteries to seek medical attention. And our approach to that shouldn't change until we have data to suggest otherwise, as far as just emergent removal, pre-removal mitigation strategies, and also the post removal neutralizing acetic acid irrigation to reduce the hydroxide that's in the esophagus as a result of the battery. But I think there's a lot of opportunity for other manufacturers at this point to adopt a similar titanium-based technology that meets or exceeds this new technology that's out on the market. It's also really important for electronics manufacturers who utilize coin cell batteries in their devices to consider the safest and most advanced option for their products, because we ultimately want to prevent children from having severe injury and death, from accidental ingestion. And as we get more and more of these into circulation, We anticipate that the clinical outcomes from these accidental ingestions of this protective battery, will be better, and we look forward to collecting additional data to better understand, how this continues to evolve with real human data. Think this is a huge milestone as far as innovation and technology development, at the battery level. To get a battery like this on the shelves for parents, caregivers, companies to utilize in their products is a huge step. And we know that while this battery it causes substantially less injury in the timeframes we studied, it still does produce some hydroxide at the tissue level. And I think ideally just continuing to research ways and investigate ways to minimize that hydroxide production by the battery, so it shuts off even sooner when it's lodged in the esophagus, is a challenge for industry to continue to work on innovative strategies to reduce that hydroxide formation. Ultimately, though, we're reducing the hazard severity by addressing the battery itself here, and it's not just trying to reduce access by making the compartment safer, which is also very important. But if we can address the hazard severity directly, that's going to have a greater impact in the long term. And so continued innovation around minimizing the hydroxide formation, shutting the battery off as quickly as possible. And I think we have a new bar for other members of the battery industry to try to meet with this new technology. I certainly applaud Energizer for putting forth the resources to invest in child safety and put forth this advancement. And our hope as medical professionals who are passionate about injury prevention, and we want to stop seeing children come into our emergency departments and our operating rooms, with life-altering and life-threatening injuries from accidental ingestion. And we have a long ways to go. I think this is an important step to get there. And our hope is that all electronics manufacturers will consider the safest options available for their products so that we can try to decrease the risk of these hidden dangers in our homes, from children.